All right, go ahead and introduce yourself, please.
Yep. My name is Brett. I actually live in the Grand Rapids, Michigan area. I'm 49 years old, and I am a registered nurse. I work at one of the local hospitals on one of their floors, and actually I'm here to talk about my experience with plantar fasciitis.
Okay. All right, Brett, how long have we been working together?
And I have been working here with Leonard for approximately 2 months.
Okay. And about a year and a half ago, you had some issues with plantar fasciitis up to this point. Can you just tell me about that?
And actually, it goes beyond that. It actually started about 3 years ago, and I believe that this started by using a treadmill at a local gym with a poor pair of tennis shoes. The plantar fasciitis developed over maybe about a month's time, and in that short period of time, I had full-blown plantar fasciitis, which was extremely painful, and it made it very difficult to work in the hospital because we do 12-hour shifts on walking a very difficult hard surfaced floor.
Okay. Now, what kind of pain would you say on a scale of 1 to 10? What kind of pain did you have, and how was that experiencing that working with that kind of pain?
Actually, that kind of pain on a 1 to 10 scale, that kind of pain probably at its worst was at about a 7. And I would pretty consistently take Motrin, large doses of it, just so I could tolerate working on my feet.
Okay.
Probably the worst of it.
What kind of professionals did you go to see to help with your pain and things like that?
Actually, the first person I saw was a local podiatrist who actually fitted me for a pair of orthotics. They're quite expensive too. And that was my first real attempt to get some kind of help. And I did not find that helpful at all.
Okay. Said you've been to quite a few massage therapists and done some physical therapy also.
Yes, actually, from that first podiatrist, I saw a second podiatrist who pretty much sold me another pair of orthotics, and I didn't find those orthotics helpful either. And this second podiatrist actually was giving me steroid injections in the bottom of my feet. What happened there is it would give me pain relief for about a month,
Okay.
and then as that steroid wore off, the pain would come back. It never really resolved the plantar fasciitis. In this 3-year period of time, I've seen individual that does acupuncture. I was going to him for about a total of 4 months. That maybe gave me some slight pain relief, and then in this 3-course-year period of time, I actually had a third pair of orthotics made also. I've been to multiple massage therapists, and it would give temporary relief, maybe 24 hours, such as that, but nothing really resolved until I started to come and see Leonard here.
Did you do some physical therapy also? I think.
I did. I did physical therapy in that 3-year period of time also, and that was I think I had authorization for 2 months, and I was going twice a week, and that actually, I didn't find that very effective either.
Okay. So you've been working with me about 2 months. If I remember correctly, I think you came in with a pain scale of about 5 or 6.
That's correct.
Okay.
Yep.
So within those 3 years, it come down from seeing, the podiatrist. I'm just trying to get this correct. Physical therapist, multiple massage therapists, come down 1%, 1 point basically on the pain scale from starting at a 7 down to a 6. Is that correct?
That's about it. It never really resolved.
Okay. So we've been seeing each other for about 2 months. And what's your pain scale now?
I would say that in this short period of time that we've been working together, I have maybe, on a 1 to 10 scale, I experience a 2, and that's mostly when I wake up in the morning and I can feel some tightness in my feet and in the back of my legs. I'm able to work my 12-hour shifts, and sometimes I'll experience maybe a pain of about a 1 on a 1 to 10 scale, but for the most part, the core work that you have done with me, I think, is what's really resolved the tension in the lower legs, the feet, the plantar fasciitis overall. I'm extremely impressed with this approach. And what I find interesting is that with all the professionals I had talked to, nobody had ever brought up the topic of core work for lower leg relief.
Okay. So, but you do come to me, and we do massage therapy, and we do exercise, kind of in an integrated way. Can you just talk about the integrative therapy and how do you think that's helped?
I have found that very helpful. The massage therapy, I noticed that you do push on areas that I have not encountered before, especially in the core, along the rib line. I've never experienced any kind of therapy in those lines before. The exercises, the core therapy, the stretching, it just seems to be very much on target for plantar fasciitis. I can't imagine what else you would talk about with various problems. So I would highly recommend you for any types of physical ailments that you might be able to deal with.
Cool. So I really appreciate your time. Thanks for taking a little time to talk to me and my audience here, and thanks for being a great client.
Yeah, no problem.
Anything else you wanted to say?
No,
Okay.
no.